My name is James Meyer, pharmacist by training. I've been at Xeris Pharmaceuticals since 2017 and was here when Recorlev launched for our company in 2021. And I work in the medical affairs department, medical communications, and publications. Cushing's is a rare disease that is caused either pituitary origin, adrenal origin, sometimes ectopic. Is an overproduction of cortisol within the body. At least for endogenous Cushing's. So they're typically diagnosed, there's the typical presentation that I think most people learn about in school as far as the signs and symptoms and the physical presentation. Sometimes it's a little bit more difficult to diagnose. It could be, overweight, diabetes, insulin resistance, but also proximal muscle weakness. It varies in presentation. It's not always textbook driven. So I think that's what we're finding, especially as the, signs for possibly expanding the diagnosis and catching more undiagnosed patients evolves. Typically the recommendation is surgical management for removal of the causative tissue, but then there are certain cases where a patient does not qualify, does not elect to have surgery, is not a candidate for some reason. And in those situations, medical therapy with pharmaceuticals or radiation therapy would be indicated. So in the original trial, there was a sub-analysis that was done that led us to believe there might be some differences if we stratified the patient population based on their baseline mean UFCs. And so we expanded an analysis, and this is the post-hoc analysis that we presented at ENDO. And basically, we broke the patient population into less than 2.5 times the upper limit of normal, 2.5 to 5 times the upper limit of normal, and 5 plus the upper limit of normal for their mean urinary free cortisol. And in a way, you could say, for that population, it would be mild, moderate, and severe disease at baseline. And then we applied the primary endpoint, and we looked at dose levels, and we also looked at adverse events to see if there were any differences amongst those groups. What we noticed numerically was that in the mild and moderate groups, there was more of a normalization response versus group 3, which is the most severe of the disease, in this population. And on average, there were lower doses that were used in the mild and moderate group versus group 3, and there were fewer liver-related adverse events and fewer discontinuations in groups 1 and 2 versus 3. So I think what it shows, and is what we showed in the original SONIC study as well, is that Recorlev was effective across all 3 groups, whether it's mild or more severe, but that there was better response, and it really speaks to the need for individualization of therapy when it comes to medical management of Cushing's patients. It's not a one-size-fits-all. It's not always a traditional presentation, and we need to have, be adaptive. There needs to be continuous monitoring of these patients as they look to gain control of their disease with whatever therapy is being used. I think that, this is a post-hoc analysis. That wasn't the primary data. I do want to explore these themes a little bit more. I want to look at a covariate analysis to see if there's any other signs or signals that would help us better define this mild and moderate where we're seeing a little bit higher response rates in. There's some key population differences between each of the groups, and I think it's worthy of further exploration. And then also to look beyond the primary endpoint into signs and symptoms and additional elements that we might see some differences between these groups.